dying after the trauma, after the incident, meaning that, you know, from the time the crash occurs, all the way to the hospital, and even in the hospital itself. So this is, if you look at these 4 pillars, this is essentially where you draw your risk factors from. So you can open the box one by one, and you can, you know, dilate on the elements. I hope that is what we are, you know. So you can see now the risk factors is so many. This big box, each of them is so loaded, and you have to unpack it, and then, you know, to explain in details. Yeah, in a layman's sense, this is it. There are risks that exposes you to the transport system. There are risks that exposes you, to expose you to getting involved in a crash. There are risks that exposes you to be able to get injured or die, and there are risk factors also that exposes the person to get, you know, to get more injured or to die after the crash or during the crash, yeah, or during treatment. So in a nutshell, this is it.
Yes, thank you very much, Mr. Gassama. So before I speak to the Director of Planning at the Ministry of Transport, I would like to throw this question. Mr. Gassama has already answered some of the risk factors of road traffic crashes. You are an orthopedic surgeon at the Edward Francis Small Teaching Hospital. We've had a report confirmed, in fact, by the Minister of Transport, who said in the Gambia, we are told that on average, 115 people die annually from road traffic crashes. Police accident statistics indicated that 775 road accidents occurred annually. And currently, Gambia is ranked number 4 when it comes to road traffic crashes. As an orthopedic surgeon at the Edward Francis Small Teaching Hospital, in your own assessment of the situation, how serious are the consequences of these risk factors of road traffic crashes?
Thank you very much for the question. Yes, the Minister of Transport did give figures, including those from the police unit as well. Within our department at the Edward Francis Small Teaching Hospital, the Department of Surgery, we conducted a survey between November of last year and July of this year. And we counted the number of individuals who reported with serious injuries from motor vehicle crashes. These are road traffic injuries, for example. And from our gathering, we realized that between 14 and 17 people die monthly between this period under review from road traffic injuries. And also, what this study also gave us a clue into was, at any point in time that you have one individual dying, you have over 20 other individuals who are left with life-changing injuries. And out of these also, you have about 5 who will be left with consequences of these injuries that will change their lives. So what we have realized as a department is the injuries that are emanating from road traffic injuries have reached an epidemic proportion, and it was high time that we come out with our partners in the fight against the occurrence of road traffic injuries and sensitize the public, and then tell everybody, look, this is what is happening. Even if people are not aware, these are platforms that we could use to tell them. But in a nutshell, it is serious, and it will also interest you to understand that not only is it confined to the walls of the EFSTHA role, but even the World Health Organization has said that every year we have about 1.3 million people dying from road traffic injuries across the world, and 90% of these injuries occur in middle and low income countries like the Gambia. So yes, it is indeed a serious problem.
Thank you very much, Mr. Ka. So I will now throw a question to the Director of Planning at the Ministry of Transports. At the level of your ministry, how significant are your actions? What actions is your ministry taking in addressing problems of road traffic crashes in the country?
Okay, thank you very much. Basically, for us, the role of the ministry currently, we are taking a coordinating role. because road safety is a multidimensional issue. That's why you have health experts here. You have enforcement bit. You have education bit. So you have whole lot of stakeholders who all have a stake in the process. So at the level of the ministry, we are acting as a lead agency for road safety, and then we bring in together different stakeholders to put our efforts together to fight the menace that we are currently facing. So basically at the level of the ministry, what we have there, we have the committee and then the working group, and then the working group normally come up with a work plan, different areas. So coming back to the subject matter that we have, which is the risk factors, because we know that currently there are a whole lot of accidents that are happening, but there are different factors responsible for these accidents. But the people know what are actually the causes of this accident. Like the question that you posed to Mr. Gassama, the risk factors. The risk factors, basically they are the factors that increase or influence your chances of involving in an accident. So you have different risk factors. For example, speeding, because for us the survey that we conducted some time ago, at least 95% of the respondents say that they believe the accidents, most of the accidents are caused by speeding and reckless driving. And then speeding globally is identified as a key risk factor as far as road traffic crashes are concerned. And then the speeding also, it do not only increase your chances of involving in a road accident, but it also increases the severity, like Mr. Gassama was saying. And then you have other issues like the usage of mobile phones. If you are using a mobile phone, you can be distracted, and then you can be involved in an accident. The other thing also is like when you drink alcohol, or you consume the drug, there is a likelihood that when you drive, you can be involved in an accident. So the other factors can also be like fatigue. For example, when you are tired, and then you are driving, you can fall asleep, and then you can. So you have whole lot of accidents. So, but at the level of the ministry, the key one which came up, which is the speeding one, I think we are doing something, because currently what we are doing, we want to install the speed limit signs across the greater Banjul areas in various locations for people to know that this is the speed limit for this particular road. And we are not stopping there. We are also trying to procure these speed radar guns for the police, so that they can be able to determine who is speeding or not. And then another key risk factor, which is the drinking or drug driving also. We are also trying to procure this breathalyzer, because I don't think currently the police they don't have it. It's when someone drink and then drive, you are involved in an accident, it's very difficult for the police to detect whether they actually consume alcohol or not. So we are trying to procure these necessary equipments for the police also, so that we can contain this risk factor. So basically we have coordinating roles. So our coordinating role touches different areas, be it health, enforcement, or education.
Okay. What are for instance, maybe a few outcomes or effects your policies, your plans of actions in response to this problem have had on the population, maybe?
Yeah, currently, that will be very difficult. Like, Mr. Gassama is here. We were involved in this since like 2008 or so, but, we were going, around the circle. But I think now, we are getting our bearings, together. So we are starting, to be involved in, some evidence, based, intervention. And then it will be difficult, for us to, give the results, now. But I'm sure as time goes on, we will be able to, give out, the results that our interventions, are yielding.
Thank you very much, the Director of Planning at the Ministry of Works, Mr. Esa Drame, for that response to a very important question. Now I will throw another question to Mr. Gassama of the WHO, Health Promotion Specialist. We keep having the numbers growing. Gambia, globally, ranked 4th position currently. Why do you think, despite all the efforts of government, despite all the the increasing problems that we face on the traffic, the numbers keep growing day by day, annually, all the time? Where does the problem lie?
Excellent question. In fact, Asa has unpacked some of the boxes that I was talking about. Now, one important thing that you find yourself, you ask yourself this question, which will answer what you have said. If you look at, the developed world and the developing world, there is a vast difference. Look at the developing countries, low-income countries. They only have 1% of the fleet of vehicles, the world vehicle, only 1%. And they contribute 13% to the global road traffic calamity, death, you named it. 1 against 13. You only have 1%, and yet you contribute 13%. And look at the developed world, which has 40% of the world vehicles and only contribute 7%. 47 and 1, 13. There must be something fundamentally wrong. I have more vehicles, but I am only having few accidents, for example. But I have less vehicle, and I'm producing more accidents. So you ask, and the Gambia now is part of those countries. This is the dilemma we are fighting. There are many reasons for this. One, how do those countries respond to those risk factors that we are talking about today? One of them is speeding, for example. Speeding is a behavior, it's a human behavior. And I think ESA has made something very important. We need to be speeding alone. One program cannot finish it. But for the people to understand that speed is a killer. One important thing that you have to understand is speed, according to the WHO, according to the research or what WHO's information that we've got from WHO, it contributes nearly over 1/3 of the road traffic deaths, and almost is a factor in all the road traffic crashes. Because one is speed is a factor because it either influences the severity or of the injury or the death. So for me, for WHO or for the United Nations, what we are seeing as a problem in developing countries, or even including the Gambia, is first is how do we manage those those risk factors? One is enforcement of the speed limits, for example. Speed, if we increase, according to science, if we increase average speed by 1%, say it's 30 kilometers per hour, and you only add 40 kilometers per hour, 31 kilometers per hour, that 1% increase can result in almost 4% death, risk of dying, and also 3%, for fatal injuries. Can you imagine? 1%. And yet, if you reduce it by 5%, the speed limit, it can reduce accident by 30%. So, it is interesting. So where is the dilemma? The dilemma is enforcement. Those are people aware. Are they complying? Are the governments also taking the necessary measures in terms of enforcement, those speed limits? So that's one thing. The other thing is, if you look at the injuries also, The developed world, they were able to conquer this because they were able to make sure that those vehicles, people also, those who are there, are also wearing seat belts. I'm glad that the Gambia has, since 2008, this seat belt law is working. But again, seat belt, the threshold is only 70 kilometers per hour, meaning that even though you are wearing seat belt, the seat belt has a capacity up to 70%. So 70 kilometers per hour, sorry. So if you exceed 70 kilometers per hour, you are at the mercy of God. So why, and then this is another thing, you know, we have to understand. And I mean, of course, the seatbelt law is being enforced in most of these developed countries. But again, developing countries, we have some challenges. Of course, Gambia is doing its best. We have the seatbelt law, and now that even if you enter the car, you know, a vehicle, and say, the driver, taxi driver, they put on your seatbelt. I'm glad it's been enforced, which is good. But again, it has its limitation. The people must understand that seatbelt can only save you maximum 70 kilometers per hour. If you drive more than that, the seatbelt, there's a challenge. So we have to understand the enforcement of that. And because speed, as I said, is we can talk about it for the whole program. But another one is child restraint in some developed countries, because children usually are in the car, they are not fit enough to use the seat belt. To use, they use, I mean, child restraint, and usually that if you use that, it can reduce to up to 40 to 50%, you know, fatal injuries among children. Because road traffic injuries now, what we're saying, is a problem of the youth between 5 and 29 years. These are the people who are affected mostly, most of the victims. So, in a nutshell, to answer your question, is we have problems in, you know, those risk factors. How do we address them? Do we also have the resources to, you know, like he said, some of these things, breathalyzer that he's talking about now, we have this good news to the country, because sometimes you don't even know how much somebody has, how much alcohol, for example. If somebody is drunk, can you say how much alcohol the person has in his blood or in her blood? You don't know. The concentration you have to have, there are limits for that. And if you have this equipment will be able to tell you, because what WHO says is you have to have minimum 0.05 gram per deciliter in your blood of alcohol in your blood. If you exceed that, then there is a problem. Do we know that? You not have a breathalyzer to be able to do that. So all these things are there. And also, of course, he talked about you know, drug driving and mobile phone, for example, mobile phone texting. In fact, mobile phone, according to our law, what I saw there, the Motor Traffic Act, is very good. We have, you know, law that prohibits mobile phone, but both either is I think it's handheld, but hand-free and handheld, they are the same. So we need to change our law. Even if whether you are using hand-free or handheld, they are the same. They contribute nearly 5 to 10% of the, you know, I mean, road traffic crashes. And of course, texting is even more serious. When you are texting, the factor is about 23%. You have 23% chances of being involved in a crash. So all these things are behavioral issues. Now you need to have severe penalties, severe laws, I mean, and make sure that you implement them, you enforce them, then that's it. That's what the developed world is doing. Despite the numbers, of course, we cannot prevent completely road traffic crashes. It must happen because this is human behavior. But you need to also have a system in place that will accommodate those factors, and at the same time, it will reduce the death and the injuries.
Thank you very much. That leads me to my next question. He has highlighted the significance of enforcement of our regulation. There also needs to be reform of some of these regulations that we have, the traffic, you know, regulations. He has cited some examples. As a healthcare professional and orthopedic surgeon, in your own medical examinations, what are the causative factors of road traffic crashes in the Gambia?
Okay. If you look at the causes, for example, we can, aside from the risk factors, the 4 main risk factors that Mr. Gassama already mentioned, we could unpack some of them, and I will also highlight a couple of them that are of medical significance to those of us. For example, the factor that influence the severity of the injuries when a person is involved in a road traffic accident. Science has proven that if you're wearing a seat belt, and the car is not overspeeding, less than 70 kilometers per hour, even if you are involved in a road traffic crash, the possibility of you dying in that crash is less than 30%. Now, if the car speeds beyond 70 kilometers per hour and you are unrestrained, then it means that that 30% increase up to about 70 to 80% likelihood of dying. And I will also unpack one of the other boxes as well, where we talked about driver fatigue. The dynamics of road traffic accidents that we see in the main hospital in Banjul, mainly the most serious ones are coming from commercial vehicles. And mainly from the Trans-Gambia Highway, for example. These are passenger vans or trucks. And if you look at most of those drivers, having to wake up early in the morning and then travel a vast distance and having to return back the same day as well. When the human being has a limit, there are things that you cannot go beyond. One, if you are fatigued, you lose concentration, your agility goes down, and then even the abilities for you to react to certain instant stimulus becomes a problem. And this has also been a contributing factor. And I will just draw you back a little bit to the data that we collected. If you look at the months between November of last year and July of this year, December had the highest number of road traffic accidents. And this will draw us to driving under the influence and also the festive period of the year as well, when we have a lot of visitors who come around, when we have a lot of vehicles around as well, and when we also have a lot of people under the influence driving vehicles around. So coming back to your question about the things that we see, what we believe are the main causes of these road traffic accidents in this country, we can categorize them into three broad groups. One is the roads, two is the vehicle, and three is us, the citizens. If you look at the conditions of the road, for example, if the road conditions are not very ideal for our vehicles to use them, like I'll give an example, there are corners in this country where the roads are poorly lit, there is not sufficient light, and you have a driver who is visually impaired, for example, and the chances of that individual being involved in a road traffic crash are increased. And even this WHO report has also indicated that if you are driving at a speed higher than 70 kilometers per hour, even if you have the ability to react to stimulus, before the vehicle will come to a standstill, it will take you nothing less than 13 meters from that onset. And if, for example, you don't overspeed and you're driving at about 40, then that 13 meters is half. So you could see the importance of speeding, you could see the importance of the roads as well. Coming to the vehicles, this is also part of the risk factors, is one of the boxes I'm going to unpack as well. So the vehicles need to be inspected, they need to be roadworthy, their braking systems needs to be inspected and verified, their lighting systems, for example. So these are all things that are involved that must be critically looked at when we examine these vehicles. Yeah. And finally, and most importantly, is us, the users of the roads, our attitude on the roads, for example. And this could take us till tomorrow to discuss how we behave on the highways, how we overspeed, how we drive under the influence, how we even refuse to wear restraints, seat belts. Not only are we talking about people using vehicles, but even those people using motorcycles, people refusing to wear helmets. And there is, I believe, a helmet law as well in place, that people who are using motorbicycles or motorcycles need to wear helmets. And science has also proven that if you happen to be involved in a road crash whilst being on a motorbike and you're wearing a helmet, your chances of suffering from severe head injuries are markedly reduced. So therefore, it is an entire gamut of things that we could look at. But then eventually, as we progress, then we will chip in and discuss some other things as well.
Thank you very much. If you're just joining us, this is a special edition involving stakeholders in the transport industry. We have the Director of Planning at the Ministry of Transport, Dr. Musa Ka, who is from the Edward Francis Small Teaching Hospital as an orthopedic surgeon, and Mr. Mamadou Gassama from the World Health Organization. We have seen some progress in terms of roads infrastructure. Among the factors, or causative factors, that Mr. or Dr. Carr has highlighted is the road conditions, roads, conditions of vehicles, and the attitude of people. There have been some improvement when it comes to road infrastructure in the country. The government is trying to ensure that there are plans to solve, some of these problems. But the area that I would want to come in to ask you a question about is the condition of vehicles in the country. It's like the gate is open and any type of vehicle is allowed into the country irrespective of their conditions. Is there any short-term or long-term plan at the Ministry of Transport in addressing that problem?
Yeah, thank you very much, Mr. Choi. The question is, very relevant. This issue was, highly recognized, when we were updating the national, transport, policy. I think there was a policy recommendation to cap, the age of, vehicles, in the Gambia to, 10 years. That is the, you cannot import, vehicles, that are beyond the age of, 10 years. Because I think there was some sort of studies where it was found out that, the average, age of, vehicles here is about, 15, years. So there is a policy recommendation to cap, the age of, the imported, vehicles in the country to about 10 years. But these have some policy, implications because, currently if you look at the policy at, the GRA or the Ministry of, Finance is just completely opposite. Because today, if I am to import into 2021, vehicle, I'll pay more than $300,000. But if I am to bring in a 1980 vehicle, maybe I'll pay something around 50,000. So the motivation is not there for the people to bring in the newer or the safer vehicles. I think that one we need to the ministry will engage the Ministry of Finance to see how best we can implement this important policy measure, because our next door neighbor, which is Senegal, I think before they cap it to 5 years, but at some point they increased it to 8 years. But for us also at a start, if we can cap to 10 years, it will be fine, because
I think at the level of ECOWAS, in fact, there seems to be
at 10 years, for the smaller ones, and I think for that of the trucks, that one is a bit higher. But what I'm trying to say, if you look around, you will see the proliferation of second-hand vehicles. This also is contributing to that, because it's easier to bring in this second-hand vehicle, because the policies that we have in place. But like I said, it's we will engage in a policy dialogue to find a solution to it. So the second dimension is about to have this testing system in place. Absolutely. Because the truth of the matter is currently the system that we have, yes, we have a system of testing, but whether it is adequate, that is the question. So I think at the level of the ministry also, we trying to address this issue, because for example, this year, I think since last year, we created the Directorate of Transport. So we are recruiting personnel in this directorate. So as time goes on, whether the government will deal with it directly, or we will engage private partners to provide these testing services, we will, is something that will be looked into. Because if you look, if you go to other countries, you have private players who provide this testing services. So the government, at the level of the government, is to have the to to play that regulatory, function. So it's something, that, definitely need to look at, because currently, the quality of, the vehicles, that we have on our roads, they are highly, questionable.
Wonderful. You've acknowledged the problem and highlighted the interventions at the level of the ministry to bring solution. Thank you very much, viewers. We are currently discussing the risk factors of road traffic crashes. And to remind you, we will also be speaking in our local language. So maybe Mr. Gassama, I'll ask this question and then you will respond in any of the local languages you are most convenient with. So what are we talking about when we say the risk factors of road traffic crashes?
Abaraka nyin choy nyin kuma ya tabake mbe men kacha bunda men dujang kacha kuma balem kadu nko ntuluka men ndalta men moyela wala accident moto accident lam bare womu niaji be ya ko kisi bake WHO ani londe dunia la londi bundalu men ya kisi ya jako momo nyenna fula accident lam bare jama nin kememu tankoronto be amunta hadaba dum le mañalam do wala katna accident wala kake bari ngandal tawla moyla mbe men kacha kambi wala mu munaliyat na shartul jumal katna mol ka dum accident to accident ka soto munakatna accident fana na sotota aka jawya munatna accident fana munaka sabu mol ka faje comme wala mu niyol be comme kune wala akune men fudi a sembo warta bag mbole kacha kan de mune katina moka dun accident to mune atina moka dun accident to nsa munta ko mo suti andi wala nyam mbole kacha kay mune atina mbole kisi kan jangalon ko lamor lal fana hakilo balla ali atule londi tiolti al simma ko no ali hakilo de bari to le menje jang na men don kacha jang abe hadaba dingula jadi ko le bala abe moto fana nek fana ko dul fana ta moto la karola ko dul fana nata silo la karola fen jamal ba kunna tola mbola kacha kanjan to mondo batu ngalon ko na londi tiel be jembe mo jamal folaje bare nga men din donc kinku dantan tombonje wala ka moto landa tambi bore iba kono ibe wana yala je ko ka buna dron o koleata wayen sila bak kad ni moto bondi landa tambi borendi ibu ka moto nyi amunde tel katara moto bul chafuri moto bul do abe kele nyame nabe faaba busul la fa mo ne kele tel haju tawot woto kama ni be moto borendi la isa lonko moto borindo nyi hapule bala kana borendi landa tambi borendi na londi na police kundankoli men londi ko nyina mu hapoti driver nyanta moto bon la nyina nyi silankan du kare alimbe ka je koros ladi ngaka yamarlo mutalad ni ko 70 km per hour wala salve wala yaji dawda be safarin dawda ko 30 km per hour moto nyanda borla wala nyam du kare alin kana tambala ka ni tambita la dron masi wokana wala mu problem moti lana tammi boro bari esabe jan mo ko don be jan si fenjo fe fanansi ko den faya kam bari be na kacha kan pour al salon nyama ko ben ku ay be bela sula tew kadu ni bam ni la momam bang action to ile teri malbe bannaje wala mo ko ten anu dola ke la njurle fo faw woto me alon andu a besi tankanule fen jamal be jemen si tankan ka fo no accident ala la lañino ko be jele bari ala fanan kana jinen sando ko al maten ndul men mo hadaba dingoto ay hakkilol dinne o hakkilo ñi ñanta tala wala abole ñam.
Thank you very much. Now we will ask Mr. Ka. Mr. Ka, I think we can speak in Wolof. Bëggoon naa pour nga leeralal ma suñu waxee risk factors am na ay jëf yu nga xamante ni am na doxalin yoo xam ne dina yombal accident na suñu local language bi ñoom accident la ñoo understand depuis boobu léegi ñu ngi waxtaanee road traffic crashes so yow nekk nga koo xam ne yaa ngi liggéeyee Edward Francis Small Teaching Hospital nekk nga koo xam ne tamit suñu dee operations yeneen yooyu noonu si fànn boobu noonu léegi dañ bëggoon nga wax ñu yan problems yan jafe-jafeñ la road traffic accidents yi ni nekk di jur soo xoolee si you know si cases yu nga xamante ni ñu leen a register si hospital bi.
maanaam jërëjëf si laajte bi am na solo trop liñ fee waxtaanee mooy mbiri accident yi di xew si réew mi jéggi na jéggi dayo boo xam ne fi mu nekk nii daf ñu jaaxal ñun ñëpp ñun ñi nekk si liggéeyi lopitaan ñii di ministre bu amee wàllum yoon yi tamit liñ si gis mooy ne dañ toog at bële passé si weeri novembre ba juillet si at biñ nekk nii si lopitaan bi dañ doon compter nit ñoo xam ne dañoo bokk si accident ñi am si ay gaañu ak ñi see loru yi si ñàkk seen bakkan waaye suñ compter lu mu ñu woon mooy ne weer bu nekk si biir réew mi fii nii li si dem ba fukk ak ñeent wala ba fukk ak juróom-ñeenti doomu adama dina ñàkk seen bakkan si kaw yoon yi lii mooy ku bokk si moto bu am accident wala nit kuy dox si kaw yoon moto fël ko wala nit koo xam ne rider nga amee di dawal moto fël la nga daanu nga am si accident nga ñëw si lopitaan bi so liñ see gis mooy ne soo seetloo problème yi accident yëpp mun nga koo def si ñetti xaaj yi mooy benn mooy yoon ñi ñaar bi mooy moto yi ñetteel bi mooy ñun ñuy jëfandikoo moto yi ak yoon bi lii suñ jàngate lu ñu woon mooy ne yoon bi am na meloo bu moo mel boo xam ne dina tax nit ñi accident yomba faa am mooy ne yoon bi baaxut mooy ne yoon bi amul ay lampa lu si mel ni guddi nga bëgg a dawal moto amul lampa bàyyi nañ si xel tamit ne moto yi seen boppa am na moto yoo xam ne sax amuñ break seen break baaxut am na ñoo xam ne tamit dañ jee overspeed bi mooy ne koo xam ne suñ la ne dawalal nga am juróom fukki kilomètre nga daw ba téeméer ak ñaar fukk te nu speed bi gën a yokkoo rek noonu la sa chances pour bokk si accident di gën a yokkoo te soo duggee si accident tamit noonu la si sa gaañu wala sa ñàkk bakkan tamit di si gën a yokkoo so ñetteeli bunta buñ si gis tamit mooy suñ jikko ñun doomi réew mi ak ni ñoo mel si kaw yoon yi li si mel ni boo ñëwoon tey jaar si kaw yoon ñu ne la fii benn moto
gën a gàttal rek parce que lu ñu am si minute léegi agul 3 minutes sax
ok
su ko defee ñu mun a tëj
waaw si gàttal daal mooy ne comme ñoo xam ne ñu ngi jël yoon bi ñu ne la fii benn moto moo fi war a daw nga yàkkamti boo xam ne mënuloo xaar bañ def ñeenti leen li yëpp si kaw ay bunta yoo xam ne la loolu lañ gis ne mooy yokka mbiri accident yi si biir dëkkam mbaa jërëjëf.
All right, thank you very much. In just 1 minute, road safety is a multi-sectoral responsibility. It's not only the responsibility of the Ministry of Transport. So I want you to tell me, how have you been working closely with partners to ensure that there is road safety in our traffic?
Yeah, we are closely, working with, all the relevant partners in the country, I can say, because like I mentioned before, we have a working group, which is a technical group, where you have, all the relevant, stakeholders in that. Even private sector, NGOs, they are all, part of, that group. And then at the higher level, you have a committee where you have the key, government institutions. Because like I said, you have health, they have a bigger stake. You have education. You have, the police when it comes to, enforcement. And then the ministry and the local government and all the relevant, stakeholders at that level. And that, committee is chaired, by the permanent, secretary. And I can say that, I think, we are doing a good job, now in terms of, coordination. Because, if you look at the situation, there are really problems. And then, we are trying to address them. Because, for example, if you come to the emergency post-care response, services, you need to have, the facilities. For example, you need to have the services, to take care of, the accident, victims. When you reach, to the hospital also, they need, some basic, equipment. But, whether, they have those equipments, is something. And then at our level, now, we are ensuring that, those equipments are in place. When it comes to enforcement, the police, we are blaming them. But I think they are trying. They lack, certain basic, equipment also. And I think for us at our level also, we are trying to provide them with those, basic, equipment in order for them to, do their, job effectively.
Mm-hmm. So we have only 2 minutes to go, and I will want each of you to give a closing remark on a very important point. Yeah. What is the way forward? Mr. Gassama, I give you 30 seconds
Thank
each.
you very much. Thank you. The way forward is we have to look at all the essential pillars. We have to look at road safety management. We have to have safer vehicles. We have to have safer road users. We have to have adequate trauma care for those who are really involved in road traffic accidents.
Yes, Mr. Drame?
Yes, like he said, we need to work, together. It needs a collaboration between, all the stakeholders. And at our level, we will provide the necessary, lead in ensuring that, our roads are safe.
Mr. Carr?
Yes, and mine will be for the proper implementation of all these prevention strategies that we're talking about. There needs to be a proper trauma care plan, where, for example, we cannot prevent accidents, but if an individual happens to have an accident, from the accident scene, during the transportation, when he or she reaches the hospital, and eventually, even if we discharge him into the community, there should be enough resources in place to make sure that this transition becomes smooth. Thank you.
Thank you very much, ladies and gentlemen. That's all we had time for on this special edition. We were discussing risk factors of road traffic crashes. And joining me on the panel were Mr. Esa Drame, Director of Planning, Minister of Transport, Dr. Carr, Edward Francis Small Teaching Hospital Orthopedic Surgeon, and Mamadou Gassama, Health Promotion Specialist at the World Health Organization. Thank you very much. Until we meet next time. Thank you for joining us. Goodbye.